My name is Jess Townley. I'm 20 years old and I was diagnosed with type 1 diabetes at the age of 10 and became a patient at Sandwell General Hospital. So when I was diagnosed, I was brought into the children's clinic and got an excellent team of Dr. Agru and other nurses. I've always had this team every single time I've had my appointments, which has been really good. In the clinics, they showed me how to manage my diabetes with injections. At one point, for about 4 years, I was put onto an insulin pump, which was really good. And then I got really scared one summer and went back onto injections. I was with the children's clinic for about 8 or 9 years of my life. And then I moved on to the young adults clinic for about a year with Liz and other nurses, and then eventually, even though I was meant to move probably at about the age of 18, I just turned 19 and I moved to the adult clinic, and this was really successful because I had a really lovely nurse called Lynn. With the children's clinic and moving over to adults clinic, for the transition we had a meeting with all the nurses that I've had throughout my childhood: Liz, Dr. Agru, psychologist Ashley, who's also lovely, and also my new nurses, Dr. Davis, Lynn. And I found that really good because that means that then I can meet my new nurses and doctors before I move over, so I know what I'm getting, which is really good. And then having my first appointment with Lynn, it was just like, why was I scared to have appointments all this time? Like, I really enjoy the adult clinic. The team have always been really supportive with me, even if I've had like a really bad result. They've always encouraged me that I can do better and that I don't need it to be perfect.
Hello, my name's Lynn Braycott and I'm a diabetes specialist nurse for the adult services at Sandwell. I've recently started working in the transition clinic for about the last year. This is to help improve the transition period for the young person from paediatric diabetes clinic to adult diabetes clinic. So in the transition clinic, what we do is I sit in with the paediatric team so that the young person from about the age of 16 gets used to the adult diabetes centre and also the adult diabetes specialist nurse. They can then ask any questions, parents as well can ask any questions or queries that they're going to have, so that we can discuss the changes that will occur from the paediatric service to the adult service. Once they've reached the age of 18 to 19, we then have an official transfer clinic where the diabetes consultant will actually sit in as well as the diabetes specialist nurse for adults, as well as the consultant for the paediatric team and the diabetes specialist nurses for the paediatric team. They are then officially handed over to us. In this clinic, we discuss means of communication and the ways the different clinics run. So the young person, we can actually see them face to face in an adult consultation, or if they're unable to make the appointment due to university or work, we can also arrange to Skype them, and Dr. Davis will do a consultation that way. We've also got an email web-based method of communicating, which is called Patient Knows Best, and the patient can communicate to myself, Dr. Davis and the dietitian, and all 3-4 of us can be answering the questions. It can be directed at one of us or all 3 of us, and that way that helps the young person. They can also upload their blood glucose results so that we can review them and advise them again, either by phone or via email.